Welcome everyone, my name is Tristan Claridge and I'm the convener of this webinar series for the International Social Capital Association. Now, the association's mission is to advance the research and application of the social capital concept. And if you're interested in finding out more, information about the association and membership is available on our website. In this session, we welcome Dr. Sandra Carrasco from Deakin University in Australia for a presentation titled Building Community Resilience Through Social Capital. Sandra is a Peruvian Australian academic lecturing in Humanitarianism and Development at Deakin. She was previously employed as Postdoctoral Research Associate at the University of Newcastle and received the prestigious Postdoctoral McKenzie Fellowship at the University of Melbourne. Sandra holds a PhD and Master's in Environmental Management from Kyoto University and a Master's in Education from Victoria University. She has professional and research experience in the Americas, Asia, as well as Australia. Sandra has experience working with NGOs and government agencies in Japan and the Philippines, which focused on post-disaster recovery efforts, working closely with affected communities and coordinating with multiple stakeholders from the public and private sectors. Her research interests include equality, diversity and inclusion, community resilience and sustainable development, disaster and risk reduction and post-disaster recovery, governance and city planning, incremental housing, urban poverty, and migrant and refugee studies. We're delighted you've agreed to give this webinar. Welcome, Sandra, and over to you for the presentation.
Thank you very much. Good morning here in Melbourne. Thank you, Tristan, for the presentation and introduction. Thank you very much to all of you who just joined into this webinar. So I would like to start the presentation with acknowledgement of the country. So I would like to pay my deep respects to the traditional custodians of all the unceded lands, skies, and waterways. And especially from the, would like to pay my respect to the ancestors and elders of the Wurrung country, Eastern country, and Wiradjuri country, and where the campuses in Deakin are located, but also all the traditional owners of all the lands where we come together and we learn and teach in each of places we are located. So I would like to start this presentation saying, first of all, thank you very much for the opportunity to share these experiences I had with social capital. And I would like to show a little bit what is going to be my talk today. So I will start seeing the approach I have from based on literature review and also some of the studies I conducted with colleagues about how social capital can shape community resilience, all the complexities there as well. And I would like to present two case studies as part of our studies, one in Nepal and one here in Melbourne. And also introduce a special issue that I was honored to lead with other two colleagues. It was in social capital and community resilience, but not limited to disasters, also conflicts and displacements in the International Journal of Disaster Risk Reduction. So when we talk about social capital, of course, we might have listened to different definitions, is as complex as human dynamics are. But if we want to try to focus on social capital for the context of disaster recovery, which in the end as well impacts the disaster prevention. Unfortunately, the focus in most of the studies is in recovery. But based on the experiences, we are connecting this with preparedness and awareness in many cases, and which is highly relevant in the context that this world is progressing in terms of climate change, where events that are regular are magnified or are intensified and are more frequent, as we were just talking about the cyclone in Queensland that everybody's expecting and hoping it's not going to cause major damages there. Unfortunately, it's a situation that is at least based on the uncertainties of climate change, there are possibilities that could be some more frequent, so we need to be prepared for that. And I hope that understanding social capital can help seeing divert a little bit of focus from the hard side of disaster prevention, which is in infrastructure, and some physical measures, to also see something that is considered the more soft, but actually equally important, which is the seeing the possibilities of on the people to develop different capacities to cope with these disasters and these events. So when we talk about, after this context about social capital for disaster recovery, so different studies saying that we see social capital as the relationships, the networks, the support structures that exist between individuals or groups, then in the end are the ones who support the opportunities to cope with disaster, but also to make a more meaningful recovery after these events happen, and actually shake all the and destroys in many cases all the social fabric in a community or in a location. So then that's why social capital is very important. As we see that sometimes when we look at a place, it's very common to see after an earthquake hit an area or a tropical storm or a landslide, everything, the physical environment is destroyed. But in this context of massive destruction and this despair, social structures tend to be, not always, but in many cases, still existing there at different levels, with especially with the survivors, and it could be something that a valuable asset to support the recovery of these people. So and then but when we think about social capital, so we believe that these are the structures within people to people in a community or community to community, but also it's not limited to that person-to-person relationship. It expands beyond that, expands to different parties, different stakeholders, and we can see this as horizontal relationships or vertical relationships when it comes to interact with the government. And I would like to explain a little bit that a little bit later, expanding this. So but the first question is like, why we need to think about social capital, and again in terms of disaster. So what was the evidence showing us? So well, we've seen that first of all, looking at these relationships or interactions or connections, whatever you want to call this, all these linkages that we have, there is a strong evidence that all these connections that existed before are very important before a disaster, are very important in the recovery stages. So, and this is something that's quite natural whenever there is an emergency, even if we're not just seeing a big scale disasters, but for example, we see a fire in our neighborhood. So the first ones who respond, or the first ones who at least look after, see what is going on, and we help, the ones who call the 000, sometimes are the neighbors. So the first respondents are the neighbors. So that's an indicator of how important are these connections at different levels. And sometimes, or not just sometimes, in many cases, they're the ones who look for the groups that are not the mainstream group, the majority, and sometimes the most vulnerable, like elderly or children and other vulnerable people. So, but also when we talk about social capital in terms of recovery, and we think about the first stages of recovery when it's extremely chaotic, And there are so many needs there. And so in some cases, when there are enough resources to provide help to the people, or if there are even scarce resources, the prioritization of who needs more and what is the best way to distribute the help are the people who know that. Sometimes there are some needs that are the less evident, the less obvious, and the people who have these connections, who understand these connections, are the ones who advocate for not just for the fair, but also for the actual needs that are more urgent in the community in this context of emergency. And also there are other studies that shows that having this possibility to influence in the decision making, that we need to be honest, in many cases, and it's not limited to countries in the global south, it's also in the global north, even here in Australia. So the decisions are taken at top level, and it goes filtered down to the people with very few options for them to say something. But when there is the possibility through these connections and these interactions for the people to have a voice, there is a sense as well, even within the moments of despair and when they feel that they lost everything, they still feel empowered. And of course these opportunities also have a long-term impact, and definitely have an influence into the long-term recovery. It helps minimizing future risks, and also can have a big influence into prevention and building resilience in affected communities. But to explain better these dynamics within people and different stakeholders, I would like to show or present to you that what are the definitions of the types of social capital. You might be familiar with this, but I would like to explain how it not typically works, but it's a kind of summary how it happens, at least in the context of disasters. So we have a group of people, possibly some survivors after a disaster or disaster affected people, and there are connections within them. There are different interactions. Many of them might have been built before a disaster. So then we have these strong connections with people who have many cases face the same issues or similar issues, and somehow, of course, with the differences, can have similar interests and similar needs, especially in the context of disaster. And then that's the first one is called bonding social capital. So it's like all these networks, these relationships that happen within a specific network. But of course, a group of people is not the only ones who are affected, let's say, by a disaster, but there are also other groups. So, and there can be some similarities in terms of like the needs, even the feelings, or the identities, and many others that make them somehow connect. So, and this when we talk about bridging social capital, so like all these links between networks could be stronger, could be weaker, could be more frequent, could be something that's intermittent. So it can be something with these connections can be just for a single situation or a single interest or single event. But so we are talking from inside, starting to go outside. There are sometimes some organizations that might help, can be NGOs, can be universities. I've seen that they play also a good role, interesting role. It could be community-based organizations, something that could be or not part of these communities or these groups of people. sorry, and then we can also talk about bridging social capital. We're talking about starting to talk about external parties, but as we started to go up in and not just seeing horizontal relationships, but started to see vertical relationships, we are starting to talk about another type of social capital, which is a linking social capital. So it's basically the ones between the people we are working at the horizontal levels. We're starting to I mean, starting to go to these organizations could be still considered horizontal or vertical, so can be something in between, and then to reach the ones who actually are the decision makers, were the government agencies at different levels. Could be a local level, could be at national level, and even could be a bigger level than that, international level. And something interesting is here is that these relationships can happen in many ways. So, for example, can be one of these organizations that could be the linkage between government and people, could be the people who somehow have the direct linkage with government agencies, especially understanding that connecting vertically is very difficult because of it requires a lot of trust, and usually there is something that is scarce, especially in the context of disasters. Well, I think this is important to understand how I'm going to talk about the different dynamics in this presentation. So, to illustrate better with an example, I would like to use the first case study. That is a project that I conducted with a colleague in Nepal. So looking at all these stakeholder and community relationships, and mostly collaboration, seeing if there was actually collaboration or not in the recovery after the Nepal earthquake that hit the country actually twice in 2015. So you might have heard about the Nepal earthquake that hit on April 25th and on May 12th in 2015. So have a tremendous impact in the country. Many of the impacts, especially in terms of like how the physical infrastructure and the built environment has been affected because of pre-existing vulnerabilities. But there was the number of casualties and the number of people who were displaced because they lost their homes was unprecedented for the country, and together with economic losses. But in this context, so there was, together with all the losses, also the international and national support was substantial, overwhelming sometimes, so that that actually that was the motivation for me and my colleague to look at have a closer look at how this actually happened, if there's any value in seeing the relationships between these different stakeholders for the recovery, because there are many studies and many articles, academic and non-academic, that look at what happens after disasters when there is a massive influx of help or aid, and that the initial good intentions end up damaging the full process of recovery, and the most importantly, hurting the people on the ground who are already vulnerable after experiencing these situations of disaster. So naturally there was an urgency to assist the people in different locations with different needs, and there was a different engagement with different groups, organizations, formal, informal, spontaneous groups or stakeholders, and to try to support their recovery. So for this, the methodology was, well, we focus on a qualitative study. So because we wanted to capture the perceptions, all the social dynamics, and even though there are also quantitative ways to do it, but we wanted to see really go beyond that, beyond statistics, beyond numbers, and just actually trying to see in a more retrospective way what some people who actually were there, what they thought about it. So we had 3 research questions for this. So first, what are the challenges and opportunities for communities and the different stakeholders involved in recovery for the interactions and engagement in the disaster recovery process? What are the stakeholders' perceptions of community cohesion and leadership? That was very important. And what are the challenges to actually include or engage vulnerable groups that in some cases are excluded from the recovery initiatives? And I'm going to explain a little bit more about this. This last question actually came from some ideas of how the society works in Nepal, this idea of caste, of privileged groups and less privileged groups. Unfortunately, I have to say the idea that women are not always engaged in different initiatives. So that's why it was important to see that. So, so for this, we had some 23 interviews. We tried to have some balance between female and male, but of course was very difficult as for the reasons I explained. Still a patriarchal society, so it was very hard to see more female engagement, but actually we saw that. We had these key informants or the interviewers from different areas, so from the government, NGOs, volunteer groups, community-based organizations, and also universities and schools. That's why I'm telling you that different organizations, different institutions play different roles and actually can support this engagement, and seeing this relationship is very important for us. And of course, different locations and different types of roles within the organization. And of course, this is not a generalization of the whole complexities on the ground and for all these recovery initiatives, but it can give us a very interesting insight of what's happening there from different angles. So after analyzing this, so I group them in some key areas that were the most interesting. So when we look at the community and these other stakeholders, let's say external stakeholders, but that is where the boundaries between external and internal sometimes are not as clear, which is quite interesting because there are some groups that were already working with the community, so they were more engagement. There was pre-disaster engagement, and actually that helped in how they interacted and how they built trust and how they open the people were to participate or to share what their concerns and their needs. So, and that's why I just think I label this part as the enablers for community engagement and trustable relationships. I know it sounds very positive, but I think that is quite interesting to see that all these interviewers, even though we are talking about not talking about the people who were affected, but the people who provided the help, how they reflect about it. So they see that they see the value on these community stakeholder interactions, and this kind of help in terms of balancing the limited trust that commonly exists between government agencies and the communities, and that actually there was still there, that is this connection actually kind of magnify these negative perceptions and injustice from the people and reinforce the inequalities that they perceive in the whole process of recovery. So we've seen that one of the interesting findings is that the lack of communication and transparency and community involvement in the decision making makes, of course, feel people even more disconnected from government agencies and efforts, and that's also quite a value of these in between actors that supported the recovery, because they could see that understanding the local needs and having a space for the people to feel valued, so could help to build a sense of ownership and encourage the participation. So it might sound obvious, but if people feel excluded, so they will not have any interest in being part of recovery, in being part of participating in all these efforts. So, and of course, for the organizations themselves, not just talking about NGOs, it's also thinking about schools or universities, being able to partner or to interact with other organizations. We are not just talking about community stakeholder linkages, but also we are talking about organization linkages. It's very important to reinforce this trust between them, but also with the people. And help as well to build these long-term ties with communities, and also enable the opportunity to work beyond the initial recovery phase, because we've seen that just after a disaster, there is a big influx of resources, of initiatives, sometimes too much that these actors don't just try to implement things as quick as possible, but the real impacts of all these initiatives, all these process are seen just not in the short term, but seen in the long term. And if you want to see if there's something has been effective, or if you want to analyze the failures of these interventions, we need to have a long-term perspective. So, and this is something that could enable that, to see long-term vision when organizations have this possibility to interact among themselves. And the second kind of key area I was focusing when I was looking at processing all the data, it was the perception of community and cohesion and leadership that's also connected with the second question, research question. So because when we think about the community, I mean, the conventional way of thinking is that there will always be a leader. There will be always someone who the people is going to listen and follow. But the reality is that that's rarely the case. And I was showing this example, and it would be something even more evident in the following example. And in the end, I found what could be the facilitators and obstacles that for community leadership. So the community leadership and face-to-face interactions are the most trusted and more legitimate words of governance on the eyes of the people. So sometimes there are leaders that have the label of leaders themselves, or maybe they have been part of or have groups that have always been leading the community, but actually there was no real interaction with the people. So when people don't see that they're actually engaged with the people, understanding them, listen to them, so there's not this idea of leadership is not legitimate under their eyes. But at the same time, the strong local leaders, that many of them don't really have the label of leaders, they just do things and people acknowledge their leadership. So they're the ones actually that can are key in connecting communities with different organizations, especially when we're talking about crisis. And this is also very important in the context of Nepal, where they have different, if we want to see the social groups, privileged, less privileged groups, so it's very important to see these dynamics as well there, and the leadership there. So Definitely the community leaders are influential members of, when we talk about engagement, they can bridge all these connections between the people and the different stakeholders from outside. But again, they are not a single understanding of what is local leadership. And that's also interesting when we talk about vulnerable people who even in normal times don't have a voice. And because when these issues are not understood, actually just relying on leaders or what they so-called leaders, but don't represent the community, can actually reinforce existing inequalities and might disengage and might also exclude the other groups that because of how the society works are already excluded. So and again, building mutual trust is very important, and thinking in the long term. That is something that always advocates looking at the long term in terms of participation. But there's something also interesting that even we have strong leadership, when we think about from the organization perspectives, they cannot just think that all this strong level of social cohesion and involvement in the projects will always be the same and always be very motivated. So, and it might fluctuate, might require reactivation, and even if we will think about pre-disaster social structures, that this might not necessarily be the same after, and might be, after disaster is actually the time where this has been more. It's more important to look at keeping the networks active and promote the reactivation of some of these levels of cohesion and involvement. And something also interesting, and personally as a woman and as a person who is not part of the mainstreaming society in Australia, it was one of the sections of the study that appealed more to me, and I found it quite interesting. When we think about the diversity and inclusion in disaster recovery from the eyes of social capital, and especially in the context of Nepal, so where there are different existing already gender inequalities, but also what could be the alternatives for engaging these traditionally excluded. I don't want to generalize, but this is something that has been resonating in different studies, and it's important to acknowledge as well. So in the initial literature review about the Nepal earthquake, how was the recovery, there was once and again, many cases, there was a repetition of the barriers of women that they face in to be part of the recovery efforts. There were some interesting narratives and stories even within the interviews that saying that women were just even so women are perfectly able to actively participate even in reconstruction. So even in construction, because I've seen that. I work with women in construction before becoming an academic, and but in this case after the earthquake, so they were just limited to traditional tasks. The most engagement they had in the recovery efforts was doing the cleaning, sometimes helping the male, giving, passing them the construction materials. And even there was a case where they kind of the organization who actually was an external organization who saw the value of working with women. The community leaders were male, blackmailed the organization, saying that we are not going to work if you give them the women tools to work in construction. That was very evidence of how how these inequalities were very tangible there. And the women were definitely prevented to work in construction and in the repairing work, and because the community or the ones who are supposed to have the voice within the community saw that this is against the local values. But luckily there were many NGOs who didn't give up and actually still work in empowering women, but they were unfortunately still limited in terms of performing male tasks, or what they consider male tasks, and they were just unfortunate that limit. Besides, even though there was a lot of motivation from the NGOs or this advocacy groups or even universities, but they couldn't go against that. So I think that's something quite interesting. But also there were some of them, some of women, and actually there were some groups of women who started doing things independently. And something interesting is that how inclusiveness work here. So these women-led groups not just included other women, but also included we can say, more vulnerable women, so pregnant women, of course, with the physical limitations and care that is needed at the stages, included women with children, because for the eyes of the rest of the community, they were not helping, actually, they were like hindering recovery. They included the elderly or people with some disabilities, which is quite interesting. So they found empowerment, they found strength among the ones who, for the mainstream groups, they were like kind of seen as leftovers, the ones who are not contributing, actually they did a lot. So and these women who participated became role models for the rest. And actually there was these groups, these small groups started to grow and we became some more independent groups that were working in maybe a small scale, but it was quite interesting that with the help with these external stakeholders, they did something actually more genuinely community-led projects that support the long-term recovery, not just focusing on the early recovery, not focusing on reconstruction, but also looking at other areas such as recovering the livelihoods of the people and the community. So that was something that was quite interesting and personally very touching. So from this study, the conclusion was like, okay, we have participation, we have leaders, formal, informals, and there was sometimes bonding and bridging social capital. So that's why I'm telling you. So it's not a clear, I'm gonna say, definition where there is a boundary there, because community-based organizations sometimes became the ones who enabled the integration of different groups who were excluded, such as women with children, seniors. But also we've seen the interactions with NGOs that sometimes work closely with community-based organizations. So they starting to strengthening the relationships there. Our universities also played another role, and it was mostly seen in this case that the relations with the government were through these other stakeholders that supported them. So I know it might be already a little bit dense, but I would like to show another case study that was also something that was very touching and very meaningful for me. And I hope, and I think for us that we are in Australia is very important to see. So the second case study I would like to present is about the social networks that in terms of the early response to COVID-19. So I don't see the long-term response, but that's the early response, because it's the most dramatic scenarios that happen in the Melbourne public housing. And I would like to see some of the particular view of the African migrants and refugees. They were one of the biggest groups in inner Melbourne public housing estates. So we know that COVID-19, we had lockdowns everywhere, but there was what happened is that on July 4th and 2020, there was a hard lockdown that was very quickly implemented in Melbourne's public housing states, not in all, but I think at least in 2 states, where 3,000 people were residing there. They were suddenly locked out. I'm sorry, locked in. So they were prevented to leave their buildings, leave their apartments, in conditions that were already precarious for them. So the state government in Victoria, so they saw that comparison with the cruise ships where the COVID-19 spread and were out of control. So they say like these are vertical cruise ships. The tenants are likely to work on public-facing essential jobs, so they are the most vulnerable to get infected. And also we need to acknowledge as well that in many cases they are the most vulnerable in terms of the health. So these concerns that some of them might have been perhaps, because I want to see perhaps reasonable, but led to a disproportionate response and actually raised many concerns about the inequal government response. So they were actually blaming the most vulnerable, punishing the most vulnerable instead of supporting them. And it was also an evidence of the existing structural inequalities and how people who are different are treated maybe with less compassion, as I would like to say. Well, in that context of chaos, there was I have to say that I was working with the people. So I was not just after COVID, I was working with them for 2 years before COVID. I was fortunate to establish different kind of connections with them, and actually came from them that wanted to have their voices heard. So I had an article in the conversation, but this time I would like to focus on the social capital. So and see see this connection that it was obviously existing within the authorities and the government and the people. So see if there is something there, it's something we can learn there, somehow some connections, and actually that's something that helped in the early response of the COVID-19. So and the first questions here were like how the pre-COVID-19 relationships and networks could impact the response and recovery. And the approach here was not just looking at the relationships, but actually try to visualize the social networks. So in that sense, so I wanted to see how actually visualizing, putting together all these networks, because this in a similar way that I show you in the previous diagram from the case of Nepal, if I could have something like this, but more specifically of the relationships in the communities and the organizations here in this case of the public housing, and how the third question is how this social network analysis aid in post-COVID-19 can help community development, not just thinking about the pandemic, but also in the long term. So so the approach, again, is not just to look at the social capital, so explaining the networks and the implications of this, but also going a little bit beyond that, looking at the social networks. Even though in some cases, social capital, social networks are seen as the same thing. I think actually, I found that there are some differences, and it's worthwhile exploring this. So, we can think in more simple terms that social capital is the social content and the social networks are the social structure. So, and of course, they both complement each other. And when we combine both, so social capital and the social networks, we can see more clearly the mechanisms by which the social capital, these connections and the outcomes actually happen. So, as I mentioned before, working with vulnerable communities, excluded communities, and I have to say also healing communities, because many of the residents from mostly my target was the Horn of Africa coming from are refugees or are migrants who are joining the families who were resettled in Australia as refugees. So we are thinking about people who suffer different trauma, people who have many issues with figures of authority. So because it's documented that many of them were not just discriminated, so they were victims of crime from the police in the countries where they stayed before they were resettled. So there was a big lack of trust, but it was combined with trauma, with anxiety, and with fear from whatever represents authority, not just the police, but the governments. And this is something that is being carried here. And we see these communities as healing communities that is still not, that need to be considered in this way. So, that's why it was very hard to connect with them. I would say I was privileged to have the pre-existing networks with them, relationships that somehow helped me and my team to conduct this research. And of course, it was also motivation to be very careful in the way how I frame the different statements and different analysis with them. So naturally, it was not easy to find people who were willing to talk. So that's why the sample was smaller. So we're talking about 9 in 4 months, but I wanted to have a little bit of mix. So not just looking at the formal community leaders, but also the informal community leaders. We've seen from the case before that someone who has the label of community leader doesn't necessarily represent the community. And also have some perspectives, some external organizations and individuals who assist in the residents in the recovery. So for this, I would like to also point out what the literature says about the social networks and the support structures in migrant communities. So we're seeing that migrants and refugees face displacement, but also need to integrate in a specific context. Well, that where they have many concerns about the well-being, mental health, that actually is a big results in a big challenge when we're thinking about rebuilding social networks, something that was supposed to be in a pre-disaster stage when there's a community that is relatively in normal times stable. That's not something that would naturally happen here. So migrants have negative experiences, as I mentioned before, from the forced migration and transition to a third host country and a third country, because we can call it Australia here in this case. And it's also something that limits the possibility to build the trust and see the benefits of all these relationships that will happen and just simply avoid this and just live in their own world. And it's very, very challenging, especially when we're thinking about disaster and disaster recovery. Also, something that is perhaps more obvious is that there are differences in terms of culture and language that also limits the possibilities to integrate with the rest of the society. And also thinking about the limited knowledge of the even not just limited to culture awareness, but also the socioeconomic inability and insecurity that many people in the community face. And something interesting as well, that the exclusion and inequalities as well influence their decisions to build or not build networks. So we're seeing extra layers of complexity in this case. So the area of study, if you are not familiar with Australia, with Melbourne and Australia, of course. So it was in Melbourne, in the inner suburbs. We know that the migrant communities are not concentrated all in inner Melbourne, but I wanted to see those because it's where there are higher concentrations of refugees and migrants from the Horn of Africa in a single place. So the rest are dispersed in different suburbs. I would say that I would focus mostly on the Carlton housing state. I have to say that's not the one who faced a hard lockdown, but of course, because the networks there within the community were very strong, they were also, first they were connected with what happened in North Melbourne. So there's the one who faced the lockdown, and Flemington as well, but also they were in fear that was going to happen to them at one point. So, and so from the findings from this study, and if you see, the idea was to have more visual work on visual tools to make the analysis. So we call what's called sociogram. So trying to see different connections. So we have the three interviewees from the community here. So 3 with ABC here in the diagram. So one from the Eritrean community was actually the leader there, and it was not just leader because of the label of leader. It was actually doing a lot for the community. There was a Somali lady who was not a formal leader, but it was someone who was very well known within the community through her handcrafts and different activities. Also, like advocate for Somali arts and expressions that want to share with the rest of the Australian community. So that was very well known. And there was another resident from the Harari community. It's a group within Ethiopia. There's also a kind of like ethnic minority there, which faces different challenges in terms of inequalities and discrimination. So so in this sense, I tried to map and how they interact among themselves, how they influence within the community. So there are different ways how they interacted, how one group targeted, for example, the Somali women, the woman. So she was more concerned into the moms, into the kids, into even the senior ladies who were not able to receive the information properly. And something interesting that also I have to say that these connections, for example, with the Harari person here, is that since he was not the formal leader and he perhaps had a kind of broader perspective of things, so it was interesting to see how he mentioned that he connected with other group that was not commonly part of the network, was the other residents, especially the seniors, were living in another tower or in another part of the towers of the state, and because otherwise they would have been disconnected. The seniors, and were not migrant seniors, they were Australian, European, from European background. If we can say that, of course, physically very different and culturally, of course, different, but they were seniors, and actually there was the opportunity to connect with them. It was quite interesting. So and this kind of connections kind of make it was very interesting, but also from the positive side. So there are new connections there. The 3 of these interviewees became health concierges. So it's the ones who were sharing the information to the rest of the residents, because we need to understand when people have trauma, it's very hard to try to have some trust, and people were very scared. They have experiences of the police kidnapping the children and asking money for them. So we are seeing about this level of trauma that they have, and sometimes not returning home. So it is what I experienced before coming to Australia. So, and they were thinking that just for the COVID test, so they were genuinely stressed and scared that they would be killed even. So, and there's the ones who shared information, and it was very key for the people to get actual real information. And for when we think about also bridging networks, so going a little bit outside of the community, there were key stakeholders like the AMSA, from the colloquially commonly known as the North Melbourne Mosque. So which is interesting that how they start to mobilize youth. And something interesting that the youth before COVID, so they were the worry of everyone. So they're saying the youth would be going to bad relationship with bad people. They have developed bad habits, but actually they are the ones who became the bridge between the community that was isolated, segregated, and the rest of the society and information. So it was quite interesting. Another key stakeholder that also was very successful here, because they were the ones who have a strong connection with the community, was the Carlton Neighborhood Learning Center, were the ones who suggested the idea of health concierges, and they were the link with CoHealth, that actually CoHealth worked with the DHHS and the government agencies. So that there was the ones who, only because they have these long-term relationships and understood that they are healing communities, they were able to address the people there and facilitate these interactions and the trust in terms of information and the recovery that came later. So, and I think about the relationships with more up at linking networks, so more at the vertical networks. So our external networks, I've seen that one interesting case was from the Victoria Police. So and it will work through the community liaison and Victoria Police, who actually understood the needs of the people, and or at least not fully understood, but it's like had that advocate for the need to understand the needs, because as you can imagine, not knowing the needs could lead to a disastrous response, and actually something that happened, and many people complained within the communities that the assistance that were provided was not correct. The food, this is something basic, but it's not based on their values, and I think that was very powerful, and to see how this perhaps the people have no authority under the eyes of the government, but having these organizations in between help to ease this, and somehow to have some trust, and not to and balance this fear from the community that had with the authority. So conclusions from this study, so answering the question, so how these pre-COVID relationships actually supported the response and recovery, and there was very important understanding. First, because they understood where the communities are coming from, understand that the structures of leadership are different, and seeing that these connections are not limited to the response, but also need to happen in the long term. And seeing that the second question, how visualizing social networks could facilitate the community engagement. So when I analyzed the sociograms, actually seeing that all these interactions supported the recovery, but it's interesting to see how these connections happen. So that intermediate organizations or groups that could facilitate that, it's very good to see this in a graphic, because we can actually see where they are working, how they're working, how is interaction. We've seen that most of the cases there was no interaction directly with the government, but it was through these organizations, and it was very tangible and evident here. And for the last question, which is actually the most interesting for me, is like how this social networks analysis can impose community, can help also not just in the early recovery, but also in the long-term recovery and development. So so analyzing all these networks, actually seeing something beyond the actual response to something that could be used in the long term, and I would like to explain more in detail. So there is something that is evident here. There is residential segregation, perhaps not physically, but culturally. We are talking about segregated people. We are talking about people who don't feel integrated into the society, and we are talking about inner Melbourne. So we're supposed to be, even if we don't want to connect it because of the density, because all the the roads and infrastructure is there, but they are kind of islands, and the people feel themselves that understand that. And this is kind of like a dilemma here, because from one side, the people, they feel safe inside. They feel like, I was talking with women and say, here nobody looks, they say, here nobody looks at me when I wear a hijab, when I cover my face, and everybody says hello to me. Well, if I'm outside of the community, of outside of the States, people look at me very weirdly, so because they are different skin color, because they have different outfits. But at the same time, this prevents the integration with the rest of the community. We don't want them to be segregated, because we've seen that will be the consequences. The idea is integration, definitely not assimilation. Is not the word. So we don't want them to lose who they are in order to become part of our society. So of course there is value, and it's very rich cultural diversity within the communities, even though from outside might be an homogeneous group, but it's not. So there are many differences, but together with the diversity that's very valuable and rich, there is also problems in terms of cohesion. So what I would like to say is that the differences that existed before in the Horn of Africa, in their home countries, for many of them, even not just for the ones who came from them as migrants, but also for the second generations, it still exists. So there's also something that weakens the sense of cohesion and community and unity. Sometimes there are groups that are kind of like didn't really like each other back in their home countries. Like if it's like some tensions there, these tensions still exist here. So it's something that needs to be worked and see how it could be some more unity here, some cohesion. And I think it was quite interesting to see that being many of them, they feel united in the adversities and when they are facing the COVID-19. A surprise here was like what was the worry of everybody in before COVID. Actually, is seeing that the youth are social agents, so there could be the connections, and there's perhaps there's a group that should be considered more when we think about not just responding to disasters, but also looking at the community development. And definitely long-term community engagement is crucial. We cannot just expect to go once and look at trying to find community leaders there and listen to the leaders and just go and do something for them without really knowing them, without really being there with the people. Because we need trust, and it's trust that is not something that's easily achievable with people who are facing trauma and displacement and all this. Is of course we need to think about continuity and scalability. We just not limited there. We need to see beyond this small scale and see how we can scale up and to see for if you really want sustainability and resilience within the communities. And also, I would like to point out that we need to address the social capital inequalities. So because there are no even though there's value in the day-to-day relationships, and there's importance in generating different connections, vertical connections, horizontal connections, and in this case, which is actually the more challenging, they cannot divert us or thinking that there are inequalities, there are marginalization, there are vulnerable communities, and we need to think that we cannot just continue with the one-size-fits-all approach when we're thinking about not just the African community, but I would like to say for the different cultural diverse communities that we have in Australia. So I know I'm talking a lot, but I would like to finish with the with the last part, which is something that I mentioned before. So we had a special issue in the International Journal of Disaster Risk Reduction. So I was privileged to lead this, but work together with Professor Chihochi from Kyoto University and Dr. Lia Magitan from the University of Newcastle. So we had this special issue. That's one of the leading journals in disaster management. And it was interesting because from this we could see different perspectives. So they were in the end. I would invite you to look at these the papers here. So there are 28 papers that were accepted for publication. There's a diverse in the approaches that they have. So we have, even though mostly focus on disaster context, but also we've seen some that focus on more specifically on COVID management and recovery. Some other focusing on building resilience among refugees, not necessarily related to disasters, and also others in displaced communities. So we have a very interesting geographical distribution. So we have most of the papers we had were from Asia, but also with the Americas. So not limited to the United States, but the whole continent. We have some Oceania, we have from New Zealand, from Australia. We have from the Middle East, we have from Africa, we have from Europe, and we have some studies that cover not just one single case study, but focus on different areas, different geographical areas. In terms of methodology, so most of the studies were qualitative, but also some mixed methods. We're also studies who focus on quantitative, and also others. One was on contextual analysis, and so there was the different, quite interesting to see this diversity. And from this, from seeing all these different studies, so there were some key points that were interesting from here. I would like you to, if you would like to look more closely. So something quite interesting in terms of impact of underrepresented and marginalized groups. So we have papers focused on informal settlers. And it was interesting to see that sometimes we tend to focus on the illegality, but rather than seeing the possibilities to engage them. So if you see the social capital side of it, in terms of when we engage with the communities and not just overemphasizing illegality, we could see opportunities for have a better disaster management and city planning. Definitely, so there are seeing that the government is not the only actor there, so there are also the different stakeholders that could empower the community, and especially perhaps the most vulnerable and traditionally left out from these initiatives. Understanding the vulnerabilities of some discriminated groups is also important, and also to see the value on not or different approaches, not just in terms of being sensitive to different cultural groups, but also seeing the value of the knowledge, and especially with thinking about indigenous communities. Something interesting is that these different studies were not limited to building community resilience per se, but going beyond that. So like there was different papers were focusing on education and children engagement. So not just focusing on the response stages, but also how we can build a culture of disaster prevention and a culture of disaster, dealing with disasters in a more regular basis. And not just disasters, but also thinking how can we build strain in terms of stresses that could affect us. Seeing the connection with the built environment and the social capital, especially in case of displacement, was also something very interesting. And other aspects of social capital that we think about promoting democratic participation, and not just looking at the connections themselves, but also how this affect the supply, humanitarian supply networks, for example, and also like something that is also sometimes not really seen, how social capital also could see in a way for business recovery. Of course, social capital is not the panacea, it's not the universal answer for everything. There's also a dark side, as one of the authors mentioned, dark side of social capital, which is actually something that is very interesting to see, that if we're thinking about strong bonding networks, they're actually exclusive, so can influence the external stakeholders and influence the already existing issues like exclusion. So we've seen in the case of Nepal, there was already women excluded, and if they and if there is, even if there's strong connections within the community, it also will reinforce this exclusion. So they can also create division and isolate other people. Also something interesting here is that when we think about the term of community, sometimes we tend to think that community is a monolithic single entity, and it's not actually the case. That within a group of people, there are different needs, different priorities, and it's also a challenge when we think about how we look at social capital, when we try to see all these connections and relationships, and where there's actually not always consensus and what is needed or what is the best way to approach a certain issue. So from this, just to finalize this presentation, so some gaps and some possible future studies that are needed. So it's important to look at the long term, and the impacts of disaster, armed conflicts, and also see what in terms of preparedness and recovery after disasters, and see these fluctuations, because I've seen, as I presented before, the social networks are not the same all the time. So the fluctuations in terms of social capital, how this can actually affect the coping and adaptability capacities to deal with the emergencies and crises. It's important to see how social capital can also have a negative impact when we think about people who are, again, vulnerable, or people who are displaced, and also with migrant women, and also how can this could be part of the response in terms of policies for recovery. And this this is a wake-up call to see that the traditional values, knowledge from indigenous knowledge, or in a society not necessarily indigenous, of course, different kind of knowledge that are not the mainstream, not the purely scientific, also needs to be taken into account, and see if they possibly can be effective as well, together, combined with other more technological knowledge. But sometimes when you think about prevention and response, it's the only technological response infrastructure is the only focus that the governments tend to see. Seeing the possibilities of not all these networks happens in a physical space. So it's important to see as well how the place attachment could actually strengthen these social networks that exist, and see as well how the social networks can support economic recovery. And because we tend to see about physical recovery, social recovery, but they still need to have this link with the economic and businesses recovery. So, and of course, in line with the previous one, the built environment is important to be considered, because it happens in an environment, in all these networks, even urban, rural, and this can actually support not just the analysis of this, but also how we can plan our cities, or our territories, or our spaces. So thank you very much. Would like to hear your questions if there is any.
Wonderful. Thank you, Sandra. Such a fascinating presentation, and you've presented so much material, and a lot of that coming out of the special issue. And if anyone hasn't checked it out already, I'd encourage you to have a look at it. So we'll have some questions. We've got around about 10 to 15 minutes for questions and discussion now. So feel free to either raise your hand within Zoom. You can find that under the React button down the bottom in Zoom, or you can post in the chat. And when I call upon you, if you could unmute yourself to ask your question. But of course, if you're not in a position to ask the question yourself, feel free to simply indicate that in the chat, and I'll be happy to read out the question on your behalf. So think about your questions and think about what you'd like to get in there. Perhaps I'll ask the first one while we're just waiting for people to think about what they want to ask, or perhaps to write into the chat. Sandra, I think it seems to be a common theme coming out of a lot of the research on social capital that it isn't a panacea. It isn't it's not a magical thing that can fix all problems. And what it really does, I think most people are starting to identify and are emphasizing, is that it helps to activate and to mobilize and transform other forms of capital. Perhaps that's information or knowledge or skills, or it's actually physical capital, being able to loan or share or give different things within and through social networks. And when we think about it in that kind of way, then it helps us, I guess, takes the focus away from people who might just say that all we need to do is build social capital and we don't need to do anything else. But also, I think you've emphasized how the community itself is not homogenous, and it is different, and different people have different access to networks and the ability to access benefits through networks. And so we can actually understand how those structural constraints actually can influence different individuals or different groups and communities within a particular location differently. And it seems to be something that is becoming more known and is being emphasized, but we still need to keep saying it. So I'm interested in your thoughts on that.
Definitely. It's not a universal answer. I mean, there is no universal answer for pretty much for anything. So we can see some reactions, let's say, to disasters, like I would say pretty much impulsive reactions when this, if I can quote an example, like from the case of Japan. So the Japanese government say, we will not allow any other tsunami to hit us again. So build big walls, and coastal towns are not coastal towns anymore because it's a big wall there. So instead of saying, okay, we need to protect, we need physical infrastructure, yes, of course, but we need to combine this, we need to listen, we need to see what else we can do. If there is education, if it is awareness, sometimes people, I would say that the human dimension is perhaps even more challenging, because even in the cases where there is education and there's awareness, sometimes there are other values or other ways to react that people have, sometimes unpredictable, but and then there is actually where the social capital can have an influence. I would say this because it's something I really know personally. When in Japan, and there's, and I would like to show this example because it's a country that kind of focuses on both. Disaster education is something that children from early childhood, they know. So they know every day. So they are, sorry. So they are aware that there are disasters and everything. And when I was there, and I was talking with the people, and people who live 3 kilometers from the seashore, and they say, did you evacuate? And say, no. When I was a tsunami alert, I say, like, it's 3 kilometers away. It's not going to come here. And in the end, it was like mostly the pressure from the neighbors say, "Oh, come on, we need to go. I know we don't want to, but you need to go because So that's what helped. And actually, that all the area was devastated, so they was destroyed. So these kind of things that we tend to take it sometimes for granted, or because we think, oh, it's going to happen, or sometimes we just ignore. It's very important, and to help build these connections, help build. They see different values in that. Another example there is that when it was, it was something that also resonated when I was talking about the Nepal case. One of the ideas here is because to do that research is because of the experience I had volunteering in Japan. So I was there distributing food, clothes, everything, preparing for winter at that time. And it was interesting to see. We were just so focused on distributing and doing and covering all, trying to cover the needs that we thought people would need. And we used to go to one temporary settlement because people were moved from their destroyed houses. And there was one occasion, there was like, with other group of volunteers, and we went there and we were ready to distribute and say, no, the community managers there, because they're actually part of the communities themselves, they say, stop, don't do that. We are going to do that. Go and talk with the people. They need that. They need human contact. They need to feel that they are appreciated. They need to feel that someone cares for them. So we went there, and it was very interesting to see that what they needed is to see that someone was really looking after them. And I was part of an international group, so like of foreigners, and I was like, where did you come from? You came that far to help me. Thank you. So these kind of things that only we would understand if there is someone there who could say that. And this is based on the relationships that were long-term relationships, and knowing the people, knowing the communities, and seeing how our interactions could go beyond supporting with giving material support and giving other type of support that are actually more needed then.
Yeah. And that's one of the things about social capital, isn't it? That it's more than just sandbags and distributing food, and it's more than just sharing important information. It gets to that that's social well-being, that psychological state as well. That it's actually really important for maintaining that sort of coherence of a community. So we do have a few more minutes if anybody has any questions. As I mentioned, you can either raise your hand or post in the chat. And then, of course, I'll ask you to unmute yourself and ask your question. We've had such a fascinating presentation by Sandra covering so many different topic areas. I'm sure there's some questions you have out there that you'd like to bring up. Now is your opportunity. Feel free to get involved. Just give you a moment to think about something if you have something. I'll talk a little bit more while people are thinking about their questions. So, Sandra, I think we always need more ways to be able to communicate the importance of social capital to decision makers. And I think there's some people around the world, of course, are doing a fantastic job of working out how we can communicate that. But what are some of the sort of key ways that you've been able to quickly and easily communicate what social capital is and why it's important to people who don't necessarily know what it is? They might be working in a different field or a different topic, and they're not familiar with the concept or the ideas.
Well, I have to say, first of all, as an academic, I need to be more involved there. It's something that I have to say myself, it's hard to reach higher level. So because we are a little bit into the communities, so there's a lot to do and a lot we do within the communities. And that's why it's important to see these organizations that are in between. Like in Carlton, the Carlton Neighborhood Learning Center is amazing. So I'm also collaborating with them. So I'm still doing some volunteer work with them. And that's actually something that is very interesting. But also disseminating the information based on the article that I had in the conversation. I remember early days of the COVID response, I got contact from the Parliament of Victoria that they wanted me to introduce community leaders. And I would say, like, things are not like that. You cannot just introduce community leaders and pretend that it's going to be okay. I had to say, you need to understand the community better. So I just prefer, in that sense, put them in contact with the organization who knows them, rather than me suggesting this person, because it's part of responsibility as well. So that's, for example, one thing that, as for me, it was, the most obvious thing would be me say, okay, let's contact this person. That's not how it works, unless they have the ability to go and spend time with the people and know them. I cannot do that. And it's happened as well in with other people who wanted to conduct research or who wanted to even make a documentary. It's part of our responsibility as well. Once we know the community, when we see how this social structure or social fabric works, what's the decisions that we take in this case.
Yeah, certainly. So we've got lots of questions coming up now, but we've only got 5 minutes left. So let's see if we can ask some short questions and give some short answers and see if we can get through them. So Sophia, would you like to unmute yourself and ask your question?
Kia ora. Thank you for that. So I'm working with a lot of hapu in New Zealand, Aotearoa, and we naturally form our human groups through whakapapa, layers of whakapapa and generations, so we're intergenerational. But we like to also effectively link to like other groups, like the sporting groups, environmental groups, and green parties, and not so much political movements, but movements that protect, preserve, and help us with our roles of haitiaki, we call it, or guardianship of our forest. And so I'd like to ask you, in disaster, so we've had forest fires and we're working on a project to use technology and GPS code out and fire breaks and stuff like that with our tribal youth, and to teach them the old knowledge of Tani Mahuta, so the significance of our atua, which is our god of the forest. Tani Mahuta is a big tree, and some people go to see that, but Tani Mahuta is a god of the forest. So bringing back those stories of old, but utilizing technology today to link in not only today's world, but also our purposeful meaning, protection, you know, and to excite to the next generation, because I think colonization had a little bit to do with the way that our knowledge is still getting there, per se, but it's still excelling. But we'd like to excel it a bit more right into the 21st century, because we think this is the way to look after our Mother Earth. So, sorry, taking up time.
No, I think that's very interesting. If you look at the special issue, there is one case in talking about all these beliefs, all these ancient knowledge, not just knowledge, but visions of the world that has been used in Indonesia. I think there's one of the papers that was, for me, what very, very interesting. It kind of goes between academic and non-academic, which is something very exciting. So I would invite you to look at that paper. It's very interesting, and I think that all that knowledge is something that we need to know. We need to incorporate that. We need to see the value in that. I have to say that in many cases the traditional knowledge or even the ways of seeing the world is not valued as they should be. Thank you.
Yeah, great. So we've got only a little bit of time left. Let's get one last question from Eduardo. Feel free to unmute yourself and ask your question.
Thank you very much. My question is about, we have heard much about social capital that is formed in communities that as previously established. But what about that social capital that have been forced, for example, those immigrants from Africa that you talk about, that have been forced to raise or to create social capital in order to survive in a different ways, or in a different country, sorry. Could you please talk about this forced social capital?
Thank you. Well, I think this is also something of the debate when we talk about migrants and refugees, of course. When we need to think that there is always in the political discourse, there is assimilation. So they need to live like us. They need to value, what we have here as national values. But I go beyond that, and it's something that also is in the articles up with the migrants and refugees here in Melbourne. We need to think about integration. People need to find, the ways to coexist. Their identities, their values with what is in the new environment. Yes, of course. But I have to say that it's very hard. It's very hard in a way that for the first generation, it's very hard. Like I can recall an example from I work with African women in Newcastle, and it was very difficult to see how I was mostly into livelihood recovery. So because they were like refugees from Afghanistan, and to break the values within the society, you can imagine it's a male dominant society. It was very difficult for women to be more independent. It was hard for them to think that they could do something else. But something interesting is like, I wanted to challenge it. So I say, okay, I work with a wonderful organization there was looking at women. And I say like, okay, first generation women migrants. So with the pre-migration values or vision of world is quite intact, even with the communities. And I say, okay, what if we introduce them a possibility to work in construction? Construction is a male-dominant sector. And it was interesting to see that when they were at the beginning, they were like, well, we are going because we are going to learn something else. The motivation is like to give them like, we call it in Australia like white card. It's a kind of like a small training for them, for anybody who wants to be an apprentice. So to just that first stepping stone to do that. So and they came and we started like seeing from the workshops we did, and it's like, okay, first of all, there's to see you can get a lot of money there. So construction is well paid compared to other work, and they started to see different opportunities that happened there, and it was interesting to see. One of them started to say, oh yes, I do. I like to renovate furniture, so maybe I can be a carpenter. I like to paint, so maybe I can do an apprenticeship in painting. So I don't know exactly. Unfortunately, I couldn't do the follow-up, but at least the idea was like to create these opportunities for curiosity that can actually go beyond beyond thinking inside the box, and perhaps challenging them. Going in a very male-dominant environment, but within there, what would you do? So you see, I could see there also the importance of role models. So there are some women who do small scale, bigger scale, do that. The idea of finding the ways to communicate with people. So trying to see someone who looked at them like them first physically, and they're doing something else. So that's, I had the examples of African women who were working in construction, and I asked them to tell the people that give them a message, and it was interesting. It was very powerful, that. So I think that could be a way to start dismounting all these big walls that we have, and when think about people who are different, and also for themselves, otherwise they can just follow what they believe is the normal, and it's not. There might be something else. There might be some opportunities that they might not even thought about. So, yeah.
Okay, thank you.
Thank you.
Right. Well, we've run out of time, unfortunately. So, Sandra, thanks very much for taking the time to present today. It's very much appreciated by everybody. Lots of comments in the chat about how wonderful it was to hear you speaking about this subject. So yeah, thanks very much, and look forward to hearing more about your work in future.
Thank you. Thank you very much. Thank you to all of you. Thank you. So
for everybody else, we've got a fantastic webinar series is ongoing. Check out the International Social Capital Association's website for more information about future events. I look forward to seeing you at the next one.